Hello, ladies and gentlemen. It is a great pleasure for me to speak to you about health and the declaration of Barletta for a new era of health-oriented prevention. First, what is Barletta? It's an Italian town of over 19,000 inhabitants and it's located in the province of Barletta, Andria, Trani and the Puglia in southern Italy. It is an ancient bourgeois city derived of the antique period. One could certainly say many good things about this beautiful and charming seaside town, but it's not my purpose today. What I will tell you, though, is that this city has hosted, in October 2014, an important meeting devoted to preventive medicine. Bringing together several hundred participants from different European countries, this meeting was one of the largest held in the field of nutrition and preventive cellular medicine from the last 20 years. As a participant in this conference and convinced of the usefulness of these proposals, I would like to share with you the most innovative ideas. We, the people of the world, have the possibility and the responsibility to decrease and to eliminate largely diseases that haunt the humanity from its beginning, in particular cardiovascular disease and cancer. It is with these words that Dr. Rath began a speech that will be a landmark in the history of modern natural medicine. This speech was made on October 19, 2014 in Barletta in the province of Bari, southern Italy. Addressing the audience, Dr. Rath gave a speech in which he described the fundamental basis of a future healthcare system based on prevention. Requiring that the powerful corporates should stop imposing the business with disease on the people of the world, Dr. Rath described the unique and impressive strategies that will enable humanity to free itself from the current dictatorial system in the field of healthcare. In September 2000, the United Nations proclaimed in their Millennium Declaration that they will eradicate in 15 years, so today, extreme poverty and hunger, reduce the infant mortality rate, will fight HIV and AIDS, malaria and other diseases. But it is clear today that the result is a total fiasco. Which of these 8 goals has been achieved? None. It could not have been otherwise because disease eradication could not be done under the conditions of the pharmaceutical industry investments, as can be seen. Let me give you an example in France. In this diagram, the spending on preventive healthcare accounted in 2006 a small 2% of total health expenditure. How is it possible to eradicate major current diseases with so little investment? We must draw conclusions. It's time to change the current healthcare system into a new system based on disease prevention and stop their expansion. According to the statistics from the FAO, a United Nations agency responsible for food and agriculture, 805 million people still suffer from chronic hunger, and 161 million children under 5 are stunned. The logical question that one is entitled to ask is this: what has FAO served for if there are more people suffering from hunger and malnutrition? Let's read together what Dr. Rath said in Barletta on October 19, 2014. The most common current diseases continue in epidemic proportions. Global health is being held hostage on a global scale. The current world businesses based on disease are a financial drain, especially for poor countries. Questions. The World Health Organization, all the UN organisms, as well as the states, are they still able to eradicate the most common diseases? Do you think that the future generations will spend less money on their health? Do you think that this situation should be left as it is today? If the answer to all these questions is no, our moral duty, and as a scientist, it is to halt the current system and now. Based on the previous shattering report, it is not exaggerate to say that the UN such as the WHO, but also that the governments have failed in their missions. And in such cases, we must rethink our healthcare system, or better yet, to reform it from the bottom up. Let's summarize first the principle that will guide the new healthcare system. It is important to remember that the right to life is a fundamental principle of human rights, and life cannot be conceived without health, as life is health. Health is therefore a fundamental right and the essence of the individual. The current assessment is that an overall state of health and well-being for the people of the world cannot be achieved by the interventionist medicine that treats disease as they occur. This objective to provide health for all can only be achieved when the medical field will accept to put its attention on prevention. The first step consists to explain and understand the cell. The cell is an operating autonomous unit of the human body. It can be compared to a city with all its function, allowing it to live independently or in synergy with its environment. As you can see on the picture, the cell can live in the manner of a city that has its own services, provides energy, has its protection system, its garbage system, and its nerve center that controls all. The cell also has its own power source, allowing it to function. It feeds on vitamins, minerals, trace elements, and other cellular substances needed to function. Micronutrients are the biological fuel of our cells. Research has shown that every cell that is not receiving sufficient quantity and variety of micronutrients won't work properly, and in time, deficiencies will be installed as the cells won't work anymore, and those dysfunctions will set the stage for diseases. As the process is carried out over a long period, it will take as much, if not more time to solve the vitamin deficiencies. Today, many chronic problems have been identified as being directly caused or at least associated with a deficiency of micronutrient through food intake. They include the most widespread diseases such as arteriosclerosis, the underlying cause of heart attacks and stroke, heart failure, arrhythmia, heart problems, circulatory problem, osteoporosis, and many others. Watch our internationally renowned group of scientists that some of you may not be familiar with, but will hear over the years and decades to come. It is composed of medical doctors, researchers, biologists, chemists. They are grouped around Dr. Alexandra Niedzwiecki and worked for about 3 decades on natural therapies as a means of prevention and eradication of diseases from civilization. The Dr. Rath's Research Institute, based in California, is the world's largest research center for natural therapies. Vitamins and other natural substances are the guarantee of a good cellular function and metabolism. The fruits and vegetables we eat should be grown organically to be effective. For effective prevention of diseases, cellular medicine must be completed by other preventive health measures, such as a healthy living, ways to reduce stress, having a clear air and water, and other public health measures. I told you today, many chronic problems have been identified as being directly caused or at least associated with a deficiency of micronutrients through food intake. Here is an example of arteriosclerosis. Look how the lining of arterial vessels behave when in lack of vitamin C, and mainly all the consequences that follow, in particular in key organs of the body such as the heart pump and the brain. In many countries, people have realized that if they do nothing, no one will act on their behalf. They understand that it is absolutely essential to reform the current healthcare system that only does cure diseases when declared instead of preventing them. The images above show a brainstorming session in Barletta while in Milan. Briefings takes an academic look. Training and information sessions are everywhere in France, Switzerland, Belgium, Cyprus, Greece, etc. The main complaint is that the current system does nothing to teach people how to take better care of their own health. We always think that this type of work is done in African villages, but European urban populations maintain at the moment gardens in the enclosure. But it is especially at the youth level and in schools that we should start the learning. The other way to understand the actions to be taken for the eradication of common diseases is to understand that we must eat biologic food. Since birth, men have grown thanks to the food they are eating for millennia. Unfortunately, the current agriculture is not what it was a few decades ago. It is impoverished, and many people, even in large cities, feel the need to maintain their own garden. But it is especially at the youth level and in schools that we should start the learning. Having said that, does action remain personal initiatives? What we need is a civic community action that seeks to include in the curricula of schools, college and universities, nutrition courses, nutrition therapy, and a sustained and continuing awareness on cellular dysfunctions and their consequences on human health. We already know how decisions are made in the UN system organization or other national instances, decisions that ultimately lead to nothing because ignoring the real needs of beneficiary populations and mostly ignoring the real problems. The system to be created should be designed at the grassroots communities to finally reach the national and international level. A new healthcare system that should be regularly monitored by the people. New health professions specializing in all natural, food and other aspects of preventive medicine and primary healthcare must be created. This is the only way in which the current monopoly on healthcare, controlled by corporate interests, can be overcome. Try asking one day to someone how he takes care of his health. Who has not heard the following reaction? My daughter takes care of my health, or I am well, until the day you get sick, and it is from this point that you realize the missing opportunities of taking care of yourself. The first things to do is to realize that nothing is done to prevent disease in the current system. The quest for better health is a dynamic process, responsible and permanent. Dynamic because it must be accomplished and adapted to time and the changing world. Responsible because we should not think that they are people who are taking action for us while we're sleeping on our laurels. And permanent because health is like a business life. Immobility is a way to retreat. After the first awareness, we need the second stage, that of education. It is not enough to challenge the global health agenda. We must offer a solution. Literate people. Literacy is more than the ability to read and write. It is to understand the ins and outs of the current impasse. Today, everyone is unanimous that the current framework in which healthcare is provided to patients must change and something that the system must be simply reformed. It is an illusion to think that the current system can reform from within. The system is irrevocable and must be replaced by the principle of cellular medicine. The world health of tomorrow depends on its natural or unnatural outcome. Any intermediate solution is doomed to failure. Education allows, in addition to being self-contained, to be self-reinforced as well. And when this new system is self-reinforcing, it can only lead to more participation. Everyone is benefiting except those who do not want you to know what I have to say, supporters of the statu quo. This will lead to a virtuous cycle, establishing training centers of information and exchange of experiences at the base level of communities, precisely where decisions must be taken. Actions taken at the community level should lead to a redefinition of a new health approach. Finally, worldwide cellular medicine must be the only scientific justification for actions to be taken. To achieve this goal, we need two conditions: sustainability and self-reinforcing preventing cellular medicine, and the necessity of a global literacy. The fact that key elements leading to the health of the human body are found in plants and can essentially grow everywhere also allow the dissemination of this knowledge throughout the world. The nutritional medicine and cellular goes beyond simply maintaining the health, which is already not so bad. She reduces diseases and therefore the cost of healthcare. Famine, diseases, and illiteracy are incredible tools for submission and domination of the people. The only way to defeat this evil is literacy. The alphabetization goes beyond the simple fact of knowing elect and write. It is mainly the understanding of today's world. And the more you understand, the less you are manipulable. And especially not ever let anyone tell you that your health is a matter for a specialist, physician, and other health professional. The understanding of the fact is the basis and the mother of intelligence. And intelligence is the ability to adapt to new situations and to find better solutions. Approximately 17 years ago, at the City Hall of Chemnitz, in a beautiful German town situated about 100 miles northwest of the city of Dresden, Dr. Rath addressed 3,000 people and regretted that millions of people were addicted physically and financially from corporate interests making a business from disease, including the pharmaceutical industry. The aim of this industry is not to succeed the eradication, but to leave on the persistence of diseases. This is why medications are being designed to treat symptoms and rarely to eradicate them. Consequence of this situation: despite the launch of numerous media campaigns from supporters of the status quo, diseases are advancing, progressing, and are spreading everywhere. 17 years later after Chemnitz, the diseases have not disappeared, even though many conducted battles were won thanks to cellular medicine and saved millions of lives. But we should not rest, because nothing is won in advance, as new threats are emerging and all threats are reinforcing, thanks to the defenders of the status quo. If you would like more information, please visit the following link. If you would like to order our brochure, please contact us by phone, email, or mail. Thank you very much for listening. See you next time.